Today, I'm going to talk to you about a very exciting development that we've made in the last 12 months. We've been working on improving a point-of-care diagnostic test to predict asthma attacks, and we've successfully implemented Edge AI on the device. And now we have the capability using deep neural networks to predict an asthma attack at least 3 days in advance. So this is the outline of my talk today. I'm going to talk to you a little bit about the asthma challenge across the world we face, tell you a little bit, explain to you a little bit about breath analysis, and then I'm going to show you a demonstration of what we've been doing with the development of our Edge AI breath test diagnostics. So applied nanodetectors' aim is to transform and change the way chronic diseases like asthma is managed to a more preventative approach, and giving people the tools to help them self-care and minimize symptoms and prevent them having asthma attacks. The way that we've been doing this is we've developed a point-of-care breath test, which can monitor markers of disease in the breath and predict the onset of asthma attacks. So how do we do this? This is a handheld device, and basically in that device we have a chemical sensor array that's detecting these markers of disease. This handheld device can be used by any person, a child or an adult, and basically what they would do is they simply breathe into this device, and within 1 minute they get the test results to tell them their diagnosis, and also using deep neural networks, we can predict the potential onset of an asthma attack. So as I've mentioned, in the device, we use a chemical sensor array that's detecting very low concentration, these trace biomarkers, which are down to the ppb level. This technology we're using has very high accuracy and high sensitivity compared to other technologies. Think of this like a mass spec on a chip, detecting many different chemical biomarkers simultaneously. At the same time, during the breath test, we collect physical lung function parameters. And what this enables us to do is to standardize our test. One of the challenges in breath testing is to make sure it's reproducible and repeatable. And by collecting this information, we can trigger the chemical collection of these biomarkers very accurately. And inside our device, we have embedded deep neural networks on the microcontroller that enable us to have predictive diagnosis. Unfortunately, asthma is a growing problem throughout the world. In the UK, it affects about 1 in 4 families. And you can see this is a very large global challenge. And this affects a phenomenal number of people across Europe. At least 21 million people are diagnosed. And there's phenomenal costs associated with hospital admissions and asthma attacks. In the UK, we spend around £1 billion a year on asthma attacks and asthma treatment and asthma medication. And unfortunately, about 75% of all hospital admissions are avoidable, and also 2/3 of the deaths are actually avoidable. So what are the challenges associated with the diagnosis and medical diagnosis associated with asthma? One of the key challenges that we want to diagnose disease earlier to give a more proactive preventive approach. And at the moment, there are not many objective tests that can be used to give the right diagnosis of asthma. We want to help people that suffer from asthma to have them symptom-free, but also prevent them from having asthma attacks. And what's important is to give people with asthma, severe asthma, these are people that may not be able to predict their asthma changes or a deterioration in their asthma, self-management tools, a medical device, a disease management software, where they can actually manage the condition daily in their home to prevent them having an asthma attack. So as I said, there are a number of challenges associated with the diagnosis of asthma. And one of them is looking at a more accurate test that could be used to diagnose asthma. In the UK, about 85% of people that present themselves with chronic cough is done in the GP primary care setting. So this could be a clinically based test that could be routinely used in the primary care setting. Asthma is a general umbrella term that's used for many different types of asthma. And really what's important is to identify the different subtypes. So then the patient can get the appropriate medication and more effective treatment. And where we're focusing today on this discussion is what can be done to predict and prevent asthma attacks. And so what we'll be developing is a point of care test that could be used daily in the home along the lines of a mobile application and disease management software, which can help them manage their condition more effectively. So on the basis of previous medical study, there was an extensive study looking at over 400 severe exacerbations, asthma attacks. And what this graph shows is you can see that at day 0, when the asthma attacks actually occur, there's a phenomenal change in the person's health. And what we can see here, if we go to the previous 5 to 10 days, there are changes in their respiratory conditions, their symptoms, and you can see there's a window here that you could potentially develop a test that could be used by daily monitoring to identify the onset of severe asthma attack up to 10 days. This window exists before there's a deterioration in the asthma. And so what we've been focusing on then is how we can develop our point of care breath tests to accurately predict in advance the deterioration of people's asthma. So breath analysis has been known for thousands of years, okay? There are many markers that have been generated in the breath, which are markers of disease. And in fact, the NHS in the UK have already improved the provision of an NO biomarker, which can detect a specific subtype of asthma. Our approach at Applied Nanodetectors is to develop a test that can detect what's known as volatile organic compounds. Think of these like very volatile materials like ethanol, for example, which have been well known from many different clinical studies, which can act as non-invasive biomarkers, potentially identify different subtypes of asthma, and also potentially be used to detect different asthma attacks. And this type of sensing technology to detect these VOC biomarkers is something we've been working on in the last few years to bring forward a medical device. So what I'd like to show you here is 3 examples of how VOC detection has been used. And what's interesting here, if we look on the left, the very first early studies were shown that just by monitoring these chemical biomarkers in the breath, you can differentiate between people that have mild asthma and healthy controls. In the middle example, we can see here there's shown some research identifying the different subtypes of asthma. And on the right, further work was done to differentiate between asthma and other lung diseases. So there's a lot of evidence showing that the detection of these biomarkers can accurately help in a number of different diagnostic challenges for asthma. So I'd like to show you a short video now. And during any disease, there's a metabolic change. And what you see then are these metabolic biomarkers generated by the change in the cellular mechanism will be circulating through the body as generated by a change in inflammation in the body, okay, or infection. So these biomarkers, which are soluble in blood, will be circulating around the body. But what we're interested in is detecting these volatile organic compounds, which are volatile, non-invasive biomarkers, which are transferred to the bottom of the lungs at the alveoli. And then as you exhale, these volatile biomarkers will then come to the top of your lungs and be exhaled into our point of care test. Inside our point of care test, we have a sensor array that's been sensitized and specific to a number of different biomarkers, 8 biomarkers that can be used for diagnosis and also identifying asthma attacks. So as I said, in the last 18 months, we've developed a point of care AI breath test and a mobile application. And in this test, during the exhalation, we're collecting 13 different sets of data that characterize this exhalation in 4 seconds. This information, the combination of the biomarkers of inflammation as well as infection, we combine all these data sets together, and we've been working on developing machine learning capabilities to improve the diagnosis of asthma and also the implication of point of care test, a test that could be used close to the patient to help them predict an asthma attack. And what we use is a simple scoring system that 1, after a test, means everything's fine. Score of 2 means there is a change in your asthma and there may be some intervention, which would have to follow through your action plan, which is included on the mobile application. And a score of 3 means potentially there's a serious change in your asthma and there needs to be a great change brought about by your action plan, but also to contact your care workers. Okay, so where does Edge AI come in for our benefit, for our patients? What is the real benefit of Edge AI? And the key challenge here is to give real-time feedback to somebody that's carried out a breath test. The breath test will be carried out every day on a daily process. So they would like to know straight away, once they finish this test, after a minute, is their asthma controlled or is their asthma not controlled? So we've developed algorithms that can be embedded onto our microcontroller. And the key thing here is giving a fast response, low latency to the user. Also, there's a significant challenge in making sure that we secure this information safely. And this can be done via encryption on the microcontroller itself. And secondly, this is a very low power solution. And so our device is battery powered. And so Edge AI can bring forward the benefits to use for people that potentially are trying to monitor their asthma in the home in terms of latency, privacy, and a low power application. Okay, so how do we do this? So as I said, we've embedded the algorithms on our microcontroller. We've done some external development of the deep neural networks, and then we developed a pre-trained model, which is based on the patient's condition, severity, whether they have mild asthma or moderate asthma. And then we're using a number of different software programs to then change these algorithms so they can be embedded actually onto the microcontroller. And we use a number of different software, including embed, code, to actually can pre-train the model and put this on the device itself. So just to go through the steps in the process then, so now the algorithms are embedded on the microcontroller. The user then would use the device daily, and basically this would be via a mobile application. Okay, so the patient then would open up the mobile application through a secure login, and the first thing they need to do is fill out a simple questionnaire before they do any breath tests. Okay, and then they'll be guided through to take a simple breath test at a controlled flow, and then this information then during the breath test is then stored on the flash memory inside the device. Okay, all this information is stored on and analyzed using the deep neural networks. Okay, so then we use the deep DNNs to predict an asthma attack, let's say 3 days in advance, and we have an accuracy of up to 90%. And following use of this test daily, we can personalize this device and show more benefit to the user. So I'm just going to go through a simple demonstration. You breathe into the device, and here we see an example of the app, including the action plan and the help file. They would need to look at completing the questionnaire. I'm going to try to quickly show you a short video of the test itself. They would complete the questionnaire, And then they would breathe into the device for 4 seconds. And you can see this little ball moves up and down, and it helps the user guide through to make sure that they're exhaling at the correct flow rate. This information then is processed during using the deep neural networks, and then we can use this daily information to give them their score, which is a predictive model of an asthma attack. The score of 1 means their asthma's fine, and we can predict an asthma attack up to 3 days ahead. Okay. And so this is an integrated solution where the user would get the medical device plus the disease management software. And regularly daily use of this test, we believe, would be able to predict an asthma attack up to 3 days in advance. We've completed many preclinical studies, and what's exciting in 2021, we hope to clinically validate this technology through a number of different clinical partners and eventually start to test this in many different homes around the UK. So clearly here, using Edge AI is really developing a personalized point of care test that could be helping people with asthma to manage their asthma, but also prevent them becoming ill. So thanks for your attention.